Hello students, subscribe the Fundamental Pharmacy and press the bell icon for more videos.
Hello students, join our online course for GPAT Niper Drug Inspector to get assured amazing rank.
Hello my dear students, welcome back to the Fundamental Pharmacy. Today we are going to see another classification, that is a classification number 26. Anti-diabetic drugs, different insulin preparations, important points related to treatment of diabetes mellitus. This classification is very important for your GPAT Niper Drug Inspector and Government Pharmacist exam. So I would like to request you, please watch this video until end. My dear students, we have already seen 25 classifications. If anybody has not seen those classification videos, please go in the channel's playlist and watch all the classification videos, because these videos are very important for your GPAT Niper Drug Inspector and Government Pharmacist exam. And believe me, lot of MCQs are going to be covered from just by watching these videos. My dear students, first of all, you should know what do you mean by diabetes mellitus. So diabetes mellitus is a condition, or it is a metabolic disorder caused by different factors, like either there may be insulin deficiency or there may be insulin resistance. डायबिटीज मेलिटस एक कंडीशन क्या होता है कि इट इज अ मेटाबॉलिक डिसऑर्डर. ये मेटाबॉलिक डिसऑर्डर है जिसमें आपका ब्लड का शुगर लेवल बहुत ही ज्यादा हो जाता है. क्यों? क्योंकि आपके बॉडी में एक तो इंसुलिन नहीं बन रहा है, एक कारण ये होता है. दूसरा कारण हो सकता है कि आपके बॉडी में इंसुलिन तो बन रहा है लेकिन उसका रेजिस्टेंस हो गया है, सो उसका काम नहीं कर पा रहा है. So there are two reasons, either insulin deficiency or insulin resistance. Now what are the reasons behind diabetes mellitus? It may be either genetic or it may be due to eating habits. They say, for example, if you have bad habits, diabetes may be because of the drugs, due to lack of exercise, etc. Now this diabetes is characterized by three conditions, 3P. यहाँ पे आपको याद रखना है कि so it is characterized by hyperglycemia, glycosuria and hyperlipidemia. 3P's मतलब polyuria, polydipsia and polyphagia. 3P, 3P. पहला P क्या है? पॉलीयूरिया, मतलब आपको यूरिन बहुत ज्यादा होगा. सेकंड क्या है? पॉलीडिप्सिया, मतलब आपको हंगर भी ज्यादा लगेगा. पॉलीफैगिया, भूख ज्यादा लगेगी. When you are suffering from diabetes, if your fasting blood glucose level is more than 126 mg per deciliter, अगर आपका फास्टिंग ब्लड ग्लूकोज लेवल 126 मिलीग्राम पर डेसीलीटर से ज्यादा है, या फिर पोस्ट पेरेंडियल ब्लड शुगर लेवल if it is more than 200, you can say that you are suffering from diabetes mellitus. अगर आपका फास्टिंग मतलब बिना खाने खाए पिए ब्लड शुगर लेवल मेजर किया, अगर वो 126 मिलीग्राम डेसीलीटर से ज़्यादा है तो डायबिटीज हो सकता है आपको. और या फिर खाना खाने के बाद में 2 आवर्स के बाद में अगर ब्लड लेवल चेक किया, सो इफ इट इज मोर देन 200 मिलीग्राम पर डेसीलीटर, यू मे सफर फ्रॉम डायबिटीज मेलिटस, राइट. नाउ दिस इज द डायबिटीज मेलिटस. देयर आर डिफरेंट टाइप्स ऑफ डायबिटीज. तो यहाँ पे बहुत सारे टाइप्स होते हैं डायबिटीज मेलिटस के. सो फर्स्ट टाइप इज नथिंग बट juvenile onset diabetes mellitus. It is known as juvenile onset diabetes mellitus, or it is also known as insulin dependent diabetes mellitus, that is IDDM, insulin dependent diabetes mellitus. तो उसको juvenile onset diabetes क्यों बोलते हैं? Because it may be of genetic origin. यहाँ पे क्या होता है कि there is a destruction of pancreatic beta cells, okay, by autoimmunity. यहाँ पे क्या है कि आपके ही बॉडी के जो पैंक्रियास के सेल है उसको एंटीजन बोल के ट्रीट किया जाता है, उसके अगेंस्ट में एंटीबॉडी बनते हैं और वो बीटा सेल्स जो होते हैं पैंक्रियास के वो डिस्ट्रक्शन हो जाते हैं. बिकॉज बीटा सेल्स आर वेरी इंपॉर्टेंट. इंसुलिन जो हार्मोन है दैट इज सिक्रेटेड बाय बीटा सेल्स ऑफ लैंग्रेंज. ओके, सो विल सी इन अपकमिंग स्लाइड्स. सो जुवेनाइल onset diabetes mellitus or insulin dependent diabetes mellitus, and the reason behind this is nothing but the destruction of pancreatic beta cells. Most of them are autoimmune type because of the immunity. Second type of diabetes is nothing but the maturity onset diabetes. Second one is nothing but the maturity onset diabetes, or it is known as a non-insulin dependent diabetes mellitus. Okay, it is not insulin dependent. Why there is this diabetes? Because there is a insulin in your body, but it is become resistant. Okay, type 2 diabetes mellitus means maturity onset, non-insulin dependent diabetes mellitus, and emergency treatment requires. इंसुलिन इज टाइप 2 डायबिटीज मेलिटस एक्सेप्ट इमरजेंसी. अगर इमरजेंसी है तो भी जाके इंसुलिन यूज करना है. सो इन द टाइप फर्स्ट यू नीड अ इंसुलिन, देयर इज नो अदर ऑप्शन. यहाँ पे टाइप फर्स्ट डायबिटीज में जुवेनाइल ऑनसेट डायबिटीज या फिर इंसुलिन डिपेंडेंट डायबिटीज जो है उसमें आपको इंसुलिन ही यूज करना पड़ता है। टाइप सेकंड डायबिटीज जो है आपका मैच्योरिटी ऑनसेट और नॉन इंसुलिन डिपेंडेंट डायबिटीज मेलिटस, सो यू डोंट नीड इंसुलिन most of the time, but in case of emergency you require, but patient can live without insulin. Now there is an abnormality of glucose receptors of beta cells. Because of that there is a resistance of insulin to the patient. Okay, insulin is there in the body of patient, but it is not able to work in a proper manner. Patient has insulin in the plasma, but glucose will not respond to insulin because insulin is not able to utilize that glucose. This may be complicated by ketoacidosis also. So reduced sensitivity, and because of it reduced utilization of glucose is there. Now type 3 diabetes mellitus is known as it is due to hormonal disorders. So type 3 diabetes is because of the other reason, that is hormonal disorders, and it may be treated by, or treatment needed is nothing but the oral hypoglycemic drug. Now type 4 diabetes, it is known as a gestational diabetes mellitus. Gestational मतलब क्या, जब आदमी बूढ़ा हो जाता है तब. So type 4 diabetes mellitus, gestational diabetes mellitus, it is also treated with the diet modification and insulin. So type 1 diabetes insulin dependent, type 2 diabetes insulin non dependent, type 3 hormonal diabetes mellitus, and type 4 is gestational diabetes mellitus. So यहाँ पे क्वेश्चंस आ चुके हैं, टाइप 1 क्या है, टाइप 2 क्या है, टाइप 3 क्या है, टाइप 4 क्या है. So already very important. Okay, what is insulin? Insulin is nothing but the hormone produced by your beta cells of Langerhans. So this is your pancreatic cell, and it will have different kind of cells like alpha cells, beta cells, delta cells, and PP cells. There are 4 types of cells present in this pancreas. So alpha cells, beta cells, beta cells, delta cells, and PP cells. So alpha cell will produce glucagon, beta cell will produce insulin hormone, delta cell will produce somatostatin hormone, and PP cell will produce pancreatic polypeptide hormone. There are 4 types of cells present in the Langerhans. ये जो pancreas होता है आपका, अब उसमें ये Langerhans होता है. In the pancreatic Langerhans, you have different kind of cells like alpha cell, which secrete glucagon hormone, which convert glucose into. Beta cells are there, which secrete insulin hormone, utilizes the glucose for energy. And there is another cell known as a delta cell. Delta cell secrete somatostatin hormone, and there is another one cell known as a pancreatic PP cell, and they secrete pancreatic polypeptide. What is insulin? So insulin is required for the treatment of insulin dependent diabetes mellitus, right? इंसुलिन डिपेंडेंट डायबिटीज मेलिटस जो होता है उसके लिए इंसुलिन ही लगता है, बिकॉज दूसरा कोई काम ही नहीं कर सकता. सो व्हाट इज इंसुलिन? इंसुलिन इज अ हार्मोन सिक्रेटेड बाय बीटा सेल्स ऑफ लैंगरहंस ऑफ पैंक्रिया. सो पैंक्रिया के बीटा सेल्स ऑफ लैंगरहंस जो होते हैं वो इंसुलिन सिक्रेट करते हैं. इंसुलिन इज अ हार्मोन, इट इज अ हार्मोन सिक्रेटेड बाय पैंक्रियाटिक बीटा सेल्स, राइट? नाउ इंसुलिन इज सिंथेसाइज्ड फ्रॉम वन inactive hormone. Pre-proinsulin is there, then pre-proinsulin is converted into proinsulin, which has a 110 amino acids. क्वेश्चन आ चुका है, प्रो इंसुलिन में कितने अमीनो एसिड होते हैं? 110, 110 अमीनो एसिड होते हैं प्रो इंसुलिन में. इंसुलिन बनता है पहले, प्री प्रो इंसुलिन होता है, उसके बाद में प्रो इंसुलिन बनता है जिसमें 110 अमीनो एसिड होते हैं, और उसके बाद में इंसुलिन बनता है. एंड इंसुलिन जो नॉर्मल है, तो इंसुलिन इज अ पॉलीपेप्टाइड which has a 51 अमीनो एसिड. इंसुलिन में क्या होता है? 51 अमीनो एसिड्स होते हैं, and insulin has a 2 chains. One light chain is known as, it is a A chain, and second one is a B chain. They are joined together by disulfide bonds. Now in the A chain you will have 21 amino acids. तो इंसुलिन में 2 चेन होता है, टोटल इंसुलिन में 51 अमीनो एसिड्स होता है. तो A चेन में होता है 21 अमीनो एसिड, एंड B चेन में होता है 30 अमीनो एसिड्स. तो ये दोनों चेन डाइसल्फाइड बॉन्ड से ज्वाइन होते हैं. तो इसके ऊपर क्वेश्चन आ चुके हैं, तो आप बोलेंगे सर याद कैसे रखना है? ए मतलब क्या? अपन बोलते हैं नॉर्मली ए मतलब ए वन होना चाहिए. सब कुछ लाइफ में क्या होना चाहिए? ए1 होना चाहिए. ए1 मतलब क्या? कहाँ पे आएगा? 121, 1 for 21, ठीक है? वैसे कोरिलेट करो. ए1 मतलब क्या? A21. ए चेन में 21 अमीनो एसिड्स. अभी देखो बी चेन में कैसे आता है, तो बी कैसे दिखता है? देखो बी जो लेटर है वो आपके लिटिल बिट 3 डिजिट जो होता है उसकी तरह दिखता है. सो बी चेन मिला हो 30 अमीनो एसिड. Total amino acids are 51 in the insulin. Now, insulin dependent diabetes mellitus needs insulin treatment, right? Now, that's why insulin is given in the IDDM. What are the different types of insulin? We'll see it. Now, insulins are divided into four classes depending on their duration of action. Now, whatever insulin you are getting for diabetes treatment, it is either microbial origin or it is being made by recombinant DNA technology. पहले ज़माने में pork insulin था, beef insulin था. So pork insulin differs from human insulin by one amino acid and beef insulin differs from human insulin by three amino acids. So you have to remember this. Insulin preparations are classified depending on their duration of action. So first one is nothing but the rapid acting insulin preparation, rapid acting insulin analogs. So in that you have insulin lispro, insulin aspart, insulin glulistin. तो यहाँ पे देखो लिस्प्रो एस्पर्ट एंड ग्लूलिस्टिन लैग, ठीक है, लैग लिस्प्रो एस्पर्ट एंड glulisin. These so rapid acting. So you can see it is a rapid acting insulin preparation. Now second one is a short acting insulin preparation. In that you have regular insulin, soluble insulin. Now intermediate acting insulin preparation. ये थोड़ा सा इनका ड्यूरेशन ऑफ एक्शन बहुत ही कम होगा, रैपिड एक्टिंग होगा, फास्ट. ये इनका ड्यूरेशन शॉर्ट एक्टिंग होगा, इनका ड्यूरेशन मीडियम एक्टिंग होगा और ये लॉन्ग एक्टिंग. सो थर्ड क्लास ऑफ इंसुलिन प्रिपरेशन इज नथिंग बट द intermediate acting insulin. So in that you have insulin zinc suspension known as lente insulin, natural protamine, that is natural protamine, hagedron insulin and isofin insulin. So they are intermediate acting. Now long acting insulin preparation question इसके ऊपर आ चुका है. So in that you have insulin long acting insulin analog, insulin glargine and insulin detemir. Insulin glargine and insulin detemir. Ultra long acting insulin preparations are also there. So insulin degludec is there. We will see in upcoming slide. So you can see over here again the insulin preparation question is covered. So rapid acting insulin preparation. In that you have lispro insulin, aspart insulin and glulisin insulin. Rapid acting. So out of that aspart insulin is the most rapidly acting insulin. Lispro insulin present as a monomer. In the short acting insulin preparation you have regular crystalline zinc insulin. It is a short action, 30 to 60 minutes. It is given by intramuscular route or intravenous route. Then intermediate acting insulin preparation, in that you have natural protamine, apatron insulin or isofin insulin, lente insulin is there. Long acting insulin preparation, in that you have ultra lente preparation, ultra lente insulin, glargine insulin, detemir insulin and degludec insulin. क्वेश्चन आया था longest acting insulin preparation. Remember degludec is a longest acting insulin preparation. ये इंसुलिन प्रिपरेशन बहुत ही ज़्यादा इंपॉर्टेंट है आपके जीपैट के लिए, नाइपर के लिए और बाकी एग्जाम के लिए. तो लॉन्गेस्ट एक्टिंग कौन होता है? डेग्लूडेक. बाकी लॉन्ग एक्टिंग इंसुलिन प्रिपरेशन होता है अल्ट्रा लेंटे, ग्लार्जिन एंड डेटेमिर. ये लॉन्ग एक्टिंग है, उसमें डेग्लूडेक भी आता है, बट लॉन्गेस्ट एक्टिंग कौन सा है? डेग्लूडेक. एंड ग्लार्जिन इंसुलिन इज सप्लाइड एट pH 4. ग्लार्जिन इंसुलिन का प्रिपरेशन जो है वो pH पे ही अवेलेबल है. बाकी जो है वो नॉर्मली 7 pH के ऊपर अवेलेबल होते हैं. नाउ विल सी द डिफरेंट ओरल एंटी डायबिटिक ड्रग्स. नाउ इंसुलिन और इंसुलिन प्रिपरेशंस दे आर यूज्ड इन द ट्रीटमेंट ऑफ इंसुलिन डिपेंडेंट डायबिटीज मेलिटस. अगर आपको टाइप 1 डायबिटीज है, इंसुलिन डिपेंडेंट डायबिटीज मेलिटस, तो उसमें इंसुलिन का प्रिपरेशन यूज करना पड़ेगा. अगर आपको टाइप 2 डायबिटीज है, मतलब नॉन इंसुलिन डिपेंडेंट डायबिटीज मेलिटस, सो इन दैट यू नीड ए ओरल एंटी डायबिटिक ड्रग्स. अगर आपको टाइप 2 है, टाइप 3 है, टाइप 3 तो हार्मोनल होता है, टाइप 4 है, तो इन दैट यू नीड अ ओरल एंटी डायबिटिक ड्रग. टाइप 1 में इंसुलिन ही लगने वाला है. सो ओरल एंटी डायबिटिक ड्रग, दिस क्लासिफिकेशन is very important. Okay, so drugs for treatment of diabetes, oral hypoglycemic drugs are classified into different, mainly 3 types. Okay, so which increases the insulin secretion. First class, which increases the insulin secretion. Second class, which overcomes the insulin resistance. And third class is a miscellaneous drug. Now we'll see one by one. First class is nothing but those drugs which increases the insulin secretion. अभी ये ड्रग क्या करेंगे, ये इंसुलिन का secretion बढ़ाएंगे. So in that you have two subclasses. First one is nothing but the KTP channel blockers, ATP sensitive potassium channel blockers, first class, and second class is a dipeptidyl peptidase 4 inhibitors. Dipeptidyl peptidase 4 inhibitors. Now, in the first class, those drug which increases the insulin secretion, you have two subclasses. First one is known as a potassium channel blockers or ATP sensitive potassium channel blockers, also known as a KTP channel blockers. And second class is DPP4 inhibitors or dipeptidyl peptidase 4 inhibitors. Okay. So in the KTP channel blockers, you have sulfonyl urease. In that you have tolbutamide, glibenclamide, glibenclamide, glipizide, glyclazide, and glimepiride. So out of that, in sulfonyl urease, you have two subclasses. First generation sulfonyl urease and second generation sulfonyl urease. Oral anti-diabetic drugs, they are used in the treatment of type 2 diabetes mellitus, right? So they act by different way. So few drugs they increases the insulin secretion. कुछ ड्रग क्या करते हैं, इंसुलिन का सिक्रेशन बढ़ाते हैं पेनक्रियास से. नाउ फ्यू ड्रग्स दे ओवरकम द इंसुलिन रेजिस्टेंस. जहाँ पे इंसुलिन का रेजिस्टेंस है वहाँ पे वो ओवरकम करेंगे. And third category is a miscellaneous drug, right? So in the first class, those drugs which increases the insulin secretion, in that you have two subclasses. First one is known as a KTP channel blockers or ATP sensitive potassium channel blockers. ये channel जो potassium sensitive ATP sensitive potassium channel होता है, that is present in the pancreas, that is responsible for the depolarization of pancreatic cell. तो क्या होता है कि पोटेशियम जब ब्लॉक हो जाता है केटीपी चैनल, पोटेशियम अंदर ही रहता है, एंड बिकॉज ऑफ दैट डीपोलराइजेशन कैन हैपन, एंड व्हाटएवर sodium is there inside the cell, so that always remains inside. So that's why there is increase in the intracellular positivity, which releases the calcium, and release the calcium bring about the of insulin. So that's why KTP channel blockers, right? So in that you have first sulfonyl urease. So sulfonyl urease, in that tolbutamide, glibenclamide, glipizide, glyclazide, and glimepiride. In that you have two subclasses: first generation sulfonamides and second generation sulfonamide. So first generation sulfonamides जो है, that is a tolbutamide and glibenclamide, they are first generation. And जो G से शुरू होते हैं, glimepiride, glyclazide and glimepiride, glyclazide and glipizide, these are the second generation sulfonyl urease. They will increase the insulin secretion. Now in that you have second subclass maglitinides or phenylalanine analogs. Maglitinides or phenylalanine analog. And that you have glinides, repaglinide and nataglinide. यहाँ पे देखो repaglinide, nataglinide, and और एक होता है torglinide. So torglinide is no more used because of hepatotoxicity. Second, in that you have dipeptidyl peptidase 4 inhibitors, DPP4 inhibitors. क्वेश्चन इसके ऊपर आ चुका है. All the gliptins, sita, vilda, saxa, alog, lina. ठीक है, ये देखो लड़कियों के नाम आए यहाँ पे, सीता, विल्दा, लीना, बाकी gliptins. So all the gliptins are nothing but the dipeptidyl peptidase inhibitors. All the gliptins, sitagliptin, vildagliptin, saxagliptin, alogliptin, linagliptin, DPP4 inhibitors. ये dipeptidyl peptidase 4 inhibitors, इसका रोल क्या होता है? So this is the enzyme which involved in the metabolism of glucagon like peptide, GLP like peptide. अभी उसका रोल क्या है कि GLP like peptide जो है, that is very very important. वो अगर ज़्यादा रहेगा तो इंसुलिन ज़्यादा सिक्रेट होगा. Okay, so likewise that. So that's why insulin secretion enhancer, or they are also known as insulin secretagogue. They are also known as insulin secretagogue. Okay, तो याद रखो आप dipeptidyl peptidase inhibitors, gliptins, sitagliptin, vildagliptin, saxagliptin, then alogliptin and linagliptin. लीना, सीता, ये सब लड़कियों के नाम है, ठीक है, gliptins. Now second class in the oral diabetic drugs, those drugs which overcome the resistance of insulin. In that you have first class bigonides. ये क्या है? Bigonides. They are known as a AMPK activator. अभी AMP क्या है? Adenosine monophosphate protein kinase activator, adenosine monophosphate protein kinase activator. इसको एक्टिवेट करने वाले ड्रग्स है बाइगोनाइट्स, मेटफॉर्मिन, फेनफॉर्मिन, ये जो ड्रग्स है फेनफॉर्मिन, मेटफॉर्मिन, सो दे आर द बाइगोनाइट्स एएमपी के एक्टिवेटर्स. ये क्या करेंगे, तो ये क्या करेंगे, दे विल इंक्रीज द यूटिलाइजेशन ऑफ ग्लूकोज. ये जो है एएमपी के एक्टिवेटर्स, दे विल इंक्रीज द यूटिलाइजेशन ऑफ ग्लूकोज, पेरिफेरल utilization of glucose. Now next in that you have thiazolidine dione, or they are nothing but the PPAR gamma activator, paroxysmal proliferator activated receptor gamma activator, paroxysmal proliferator activated receptor gamma activator. So this is a gene which is responsible for the production of insulin transporters, pioglitazone, rosiglitazone, proglitazone. So troglitazone is no more used due to hepatotoxicity. Rosiglitazone can induce myocardial infarction and angina pectoris. So most commonly used drug from this category is pioglitazone, and it also increases the risk of bladder cancer. तो question आ चुका है, which drug will increase the risk of bladder cancer? So now in the last miscellaneous drug you have alpha glucosidase inhibitor. Alpha glucosidase inhibitor, acarbose, miglitol and voglibose. Acarbose, miglitol and voglibose. So all these drugs they are known as alpha glucosidase inhibitor. तो ये alpha glucosidase का रोल क्या होता है? So this enzyme is present in the brush borders of your GIT. आपका जो GIT है उसमें ये एंजाइम रहता है alpha glucosidase. उसका काम होता है to break down the complex sugars. So जो complex sugar है, starch होगा, उनको break down करेगा and it will convert into simple sugar disaccharides and sucrose. So inhibition of this enzyme will prevent the breakdown of carbohydrate and will prevent the rise of blood glucose level. तो ये हो जाएगा. Obviously acarbose, miglitol and voglibose, इनके ऊपर क्वेश्चन आ चुके हैं. अल्फा ग्लूकोसिडेज इनहिबिटर. Now there is one adverse effect of these, so they may cause flatulence and diarrhea. Flatulence and diarrhea, right? Now next is amylin analog. This is a newer class of drug, amylin analog. So amylin क्या है? It is a pancreatic polypeptide. It is a pancreatic polypeptide. Its analog are used. Pramlintide. Pramlintide is an amylin analog. It is the only drug which is approved for type 1 as well as type 2 diabetes mellitus. ये pramlintide जो है, it is the only drug which is approved for treatment of type 1 as well as type 2 diabetes mellitus. You have to remember. Now next one is the dopamine 2 receptor agonist, that is the bromocriptine, and last class is the sodium glucose contrasport or co-transporter 2 inhibitors. So dapagliflozin, इसमें जो है dapagliflozin और जो भी gliflozin से they are SGLT2 inhibitor. ये SGLT क्या है? Sodium glucose co-transporter. Sodium glucose co-transporter. So it is present in the kidney. ये ग्लूकोज ट्रांसपोर्टर जो होता है, सो SGLT2 दैट इज रिस्पॉन्सिबल फॉर द रीअब्सॉर्प्शन ऑफ ग्लूकोज फ्रॉम द नेफ्रॉन. जैसे ग्लूकोज से फिल्टर होता है, उसके बाद में उसका रीअब्सॉर्प्शन होता है, एंड दैट रीअब्सॉर्प्शन इज carried out by this SGLT2. Removal of glucose in the urine. These drugs or these category drugs also has some adverse effects known as they are more prone to urinary tract infection. सो यूटीआई ज़्यादा रहेगा. ग्लूकोज अगर यूरिन में ज़्यादा जा रहा है तो यूटीआई का चांसेस भी ज़्यादा रहेगा. सो सोडियम ग्लूकोज कॉन्ट्रापोर्ट 2 इनहिबिटर्स. सो दिस SGLT2 is responsible for the reabsorption of glucose from the lumen of nephron, and that's why inhibition of this causes increase in the excretion of glucose in the urine, and that's why these kind of drug may cause urinary. They are more prone to UTI. Dapagliflozin. Okay. Now we'll see the classification again. Anti-hyperglycemic drugs or hypoglycemic drugs or anti-diabetic drugs. Okay, they are classified into two types: parenteral drugs, those drugs which are given by parenteral route, that you have insulin and its preparation. Then GLP analog, glucagon-like peptide analog. In that you have exenatide and liraglutide. Exenatide and liraglutide. ये याद रखना है आपको, इसके ऊपर क्वेश्चन आ चुका है. Glucagon-like peptide analogs, exenatide and liraglutide. Amylin analog pramlintide. So I have told you this is the only drug which is approved for the treatment of diabetes 1 as well as 2. तो डायबिटीज टाइप 1 टाइप 2 दोनों के लिए अप्रूव किया गया है इसको यूज करने के लिए. Amylin analog pramlintide, right? Now let's move to the oral anti-diabetic drug. So those which increases the insulin release. So in that you have sulfonylureas and meglitinides. So sulfonylureas are further classified into two generations, first generation and second generation. So chlorpropamide is the first generation, tolbutamide is the first generation, and all the G's, glipizide, glycylazide, and glibenclamide, they are known as second generation. And these sulfonylureas are also known as a KTP channel blockers, potassium channel, ATP sensitive potassium channel blockers, KTP channel blockers. Then meglitinides, in that you are repaglinide, nataglinide, and drugs which increases the insulin released by other mechanism. So in that you have bigonides, fenformin, metformin, etc., etc. So these bigonides, they are known as a AMPK activator, adenosine monophosphate protein kinase activator. Then thiazolidine diamine, that you have pioglitazone, rosiglitazone. Okay, so these are known as a PPAR gamma activators. So paroxysmal proliferator activated gamma receptor. So that is an intracellular receptor, that is a gene which controls the production of insulin transporters और सॉरी ग्लूकोज ट्रांसपोर्टर्स. तो ये जो है पीपीएआर गामा, इसको एक्टिवेट करते हैं थायाजोलिडिन डायोन्स, रोपाग्लिटिजिन, रोसिग्लिटाजोन एंड पायोग्लिटाजोन. Now third is alpha glucosidase inhibitors. Alpha glucosidase inhibitor. Now this drug will prevent the absorption of glucose. This drug will prevent the absorption of sugars. So they will prevent the breakdown of complex sugars into simple sugars. Acarabose, मिग्लिटॉल and vaglibose. Vaglibose, agarabose, मिग्लिटॉल. क्वेश्चन आ चुका है. Now D2 receptor agonist bromocriptine, dipeptidyl dipeptidyl peptidase 4 inhibitors. All the gliptins, sitagliptin, vildagliptin, saxagliptin, and allogliptin. Then sodium glucose transporter 2 inhibitor, sodium glucose contraport 2 inhibitor, dapagliflozin and canagliflozin. So they will prevent the reabsorption of glucose from the kidney, right? Now we'll see the important points from this. You can see the classification again. So drug used in the diabetes mellitus, insulin and oral antidiabetic drug. So insulin we have seen different population. The oral antidiabetic drug sulfonylureas are there. They are known as insulin, secretogogue, tolbutamide, acetoxamide, chlorpropamide, tolazamide. Second generation glibenclamide, glipizide, and glyburide. Then biconides, in that you have fenformin, metformin, and buformin. Then thiazolidine diamonds, in that you have pioglitazone, n-glitazone, siglaglitazone, c-glitazone. Okay. Then meglitinides, in your repaglinide, alpha glucosidase inhibitor, maglitolol, acarabose, and volgibose. Okay. So you can see mechanism of action and their prominent adverse effects of antidiabetic drugs. So sulfonylureas में आएगा tolbutamide, glibenclamide. So they increases the insulin release from pancreas by inhibiting the ATP sensitive potassium channels, and they also increases the tissue sensitivity to the insulin, and adverse effects is hypoglycemia and cholestatic jaundice. Then bigonides, in that fenformin, metformin are there. They decreases the hepatic neoglucogenesis. जो ये क्या करेंगे, न्यू नया ग्लूकोज जो बन रहा है ग्लूकोजिनोलाइसिस ग्लूकोनियोजेनेसिस वो प्रिवेंट करते हैं and increases the insulin sensitivity to the tissue. Diarrhea and metallic taste in the mouth, they are the most important adverse effect. क्वेश्चन आ चुका है मेटफॉर्मिन का एडवर्स इफेक्ट क्या है. सो इन द metformin will have metallic taste in the mouth. Now meglitinides, repaglinide and nataglinide, they increases the insulin release from pancreas. Hypoglycemia is the adverse effect. Next one is thiazolidine, rosiglitazone and pioglitazone. जो rosiglitazone and pioglitazone है, so they are a PPAR gamma agonist, paroxysmal proliferator activated receptor gamma. So they activate the gene responsible for the production of glucose transporters. So they increases the glucose transport into tissue and decreases the hepatic gluconeogenesis and weight gain, edema. They may precipitate congestive cardiac failure, risk of hepatotoxicity. So ये जो rosiglitazone है, it increases the congestive cardiac failure risk, myocardial infarction risk, and angina pectoris risk. Troglitazone जो होता है, troglitazone has a hepatotoxicity. Thioglutatone is a relatively safe drug. Then alpha glucosidase inhibitor, in that you have acaribose, miglitol, volgibose, which decreases the glucose absorption and decreases the hydrolysis of polysaccharide. So flatulence, diarrhea, abdominal distension are the adverse. You can order this magic bullet for GPAT Niper DI Pharmacist. Read 2-3 times and qualify 100% with very good rank with our guarantee. We have very much promising result from past few years. Thousands of students they are placed in the Niper. You can also join our GPAT Niper 2024-25 online crash course. You will have live lectures, subject wise and chapter wise lecture will be there. Study material will be provided on the hard copy. Recorded lectures will also be available. Online test series will also be available. Recorded lectures, subject wise and chapter wise, study material in the form of hard copy and online test series. Everything is there in 8,000. And if you get all India rank less than 20 in the GPAT, your fees will be returned to you in the form of reward.
Hello students, order the magic bullet for GPAT Niper Drug Inspector. Read twice and qualify 100%